Restraints are used in the ED to ensure patient and/or staff safety. When it comes to restraints, it doesn't matter which type you use, it matters why you are using it. Based on why you're using restraints, there are two types: violent behavioral restraints and non-violent medical restraints. Staff may need to protect themselves by restraining a patient that is behaving violently. If used for a violent patient, they are called behavioral restraints. Behavioral restraints require provider evaluation and documentation within 1 hour of initiation. Orders cannot exceed 4 hours. And the patient must have a sitter with continuous observation completing Q15-minute documentation. Violent restraints may only be used for patients over 18 years of age. Other times, an altered, sedated patient may need restraints to stop them from unconsciously pulling at critical lines, drains, and airways. If used for this reason, you are using medical restraints. Medical or non-violent restraints require the provider to sign the order within 12 hours, and this order can be renewed each calendar day, and they require assessment and documentation be done Q2 hours or more often if necessary. A tied restraint must do two things. It has to be secure, otherwise it's not really restraining anybody. And it has to be quick release, in case there's a fire or something and you quickly need to get the patient out of bed. To meet these twin objectives, we use a quick tie knot. In just a second, everyone will get an opportunity to show off their junior woodchuck skills and tie a quick release. Here's how you do it. Wrap the cuff around a wrist or ankle. Make sure you can slip a finger between the cuff and the patient's skin. Take one of the ties and loop it around part of the bed. Now, take an end and do a lap around the other. Take a folded end and tuck it inside the wrap you just made. Cinch it tight. Now, if the patient pulls, it only gets tighter. But if you pull the quick release, voila, it's undone. Importantly, when selecting a part of the gurney to secure the tie to, make sure it's a part that moves with the patient. You don't want to raise the head of the bed only to have the patient tied down to the bottom. Restraints are best when they're not used at all, so limit their use as much as possible. Use them when you need to, but discontinue them as soon as it is safe to do so. This will minimize any risk for skin breakdown and psychological trauma for the patient. Okay, now let's see what you can do.